Welcome, 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 everybody. I'm Mrs. J, the curriculum developer here at AMCI, and I'm proud. I am excited because we are at week 6, and we've come a long way, right? 6 weeks, and you all are still here. You didn't give up. You know what that tells me? You know what? You're going to do it. You conquered last week. Last week we talked about circulatory system. These are guidelines about hypertension, heart failure, and more. We learned about infarctions. And that's probably the most, like I said last time, it is the most visited guidelines of the ICD-10-CM. Well, that's my opinion, but on the exam, it never fails. It's always there. Now, looking ahead, what are we doing today? Well, we will be expanding our reach and we will be delving into 4 chapters. Chapters 10, 12, 13, and 14. This is respiratory. Chapter 12 is, I can't remember, integumentary, musculoskeletal, and urinary system. And you know what? We're going to change things up a little bit. You're not going to listen to me give you an overview of the guidelines because you are here. If you're here, you know what to do. So you're going to hear less of me instructing and more of you doing the work. How do you like that? Well, I love it. It means that you are ready. Now, before we go any further, I want to shout out my amazing team. We have the instructors, and last time I said they are the baddest medical coding instructors, an instructional team on the planet. I stand by that. They are always doing the work, always studying, just like you. And let's not forget our interns. They're wearing the blue and they are here to help you and they enjoy it. Can't you tell? I can tell. Okay, coders, let's go ahead and let's answer your questions. The most commonly asked question, how to join Discord. Okay, you just go to any video and click the join button. It's next to the subscribe button. It's different colors. Here it's black, other places it's blue. So just click the join button. But I think an even bigger question is, or a better question is, how do you link your YouTube channel? Right? Because after you join, you're going to have to link your YouTube channel. So let me show you how it's done. All right. From a desktop, you need to open the Discord, right? So let's say you land, you're right here. You see this on the left. Now look down. See where your name is? There's a cog wheel. Click on that cog wheel. This is your settings. After clicking on the cog wheel, you'll see a menu. It will appear on the left. Click Connections right here. After you click Connections, this is where you're going to link your YouTube channel. So when the connections appear, of course, YouTube is last because it begins with a Y. So you're going to have to click the arrow to continue, but you can link whichever ones you want, but you really only have to link your YouTube. So when you click that arrow, you'll find YouTube. Click on the YouTube icon. Then after you click on it, a window will pop up instructing you to sign into your Google account. And once it's connected, a check mark will appear. And then Discord will automatically sync your YouTube memberships. Now you'll be added to the private AMCI member only channel, and this might take a few moments, so it's not going to happen right away for some people. So be patient. Okay, coders, I hope this helps. If you need more instruction, just feel free to watch this playback or ask us in the chat. We are very, very happy to help. Now, the books. The books that you're going to need for today's class. You're going to need ICD-10-CM. If you intend to take the CCS, we recommend ICD-10-CM Expert for hospitals. Number two, this step-by-step 2025 by Carol Bucks. You can get any publication between 2023 and 2025. And finally, the AMCI MCG manual 2024 and 2025 are the two that you could have, are the two options. CPT is copyright of 2025 AMA. All rights are reserved. Keyword concept FTR Chun, AMCI Feb 7, AMCI, ICD-10-CM Flip Tap, and MCG are registered trademarks of AMCI. CPC, CRC, COC, CPMA, CPB, CPP, MCPCO are owned by AAPC. CCA, CCS, CCS-P, RHIA, RHIT are owned by AHIMA, and AMCI does not own the rights to these credentials. Goals of the presentation. Number one, we're going to review Section 1, Chapter 10, Respiratory Guidelines. Number two, Chapter 12, Integumentary Guidelines. Goal 3, Chapter 13, Musculoskeletal Guidelines. And Goal 4, Chapter 14, Urinary ICD-10-CM Guidelines. And we're going to begin our instruction with respiratory guidelines. This is ICD-10-CM Section C Guidelines, Chapter 10. Now, in respiratory, you're going to be coding for conditions like asthma, bronchitis, pneumonia, and COPD. And also respiratory failure. And if I had to say, of the conditions or diagnoses in this chapter, respiratory failure is heavily nuanced because you're going to need to know what type of respiratory failure you're coding for. Is it principal? Is it secondary? And what to do. There are specific guidelines. Also, whether or not you should code it or you should sequence it as first listed. So it's always important to reference those guidelines and respiratory failure in the setting of other conditions is nuanced. And I would say COPD as well. So definitely pay attention, pay attention. Oh, COPD can occur along with other conditions. We're going to talk about that. So just want to let you know that what COPD is, and just knowing that definition will really, really help. Okay, coders, I think that's it. And I encourage you to use your MCG. Go ahead right now, flipped to chapter 10 in your ICD-10-CM section, and then take a moment to kind of see which guidelines are there and remember the ones that I told you. And now it's time to get started. How to solve an ICD-10-CM scenario the AMCI way. Number one, inventory. Inventory all diagnoses, signs, and symptoms, and sometimes procedures. They may be pertinent. Number two, go ahead and select your first listed code. Number three, apply all guidelines. And remember, trust the guidelines. All right, I'm going to ask Ms. Dolly, please, and thank you, Miss Dolly.
Thank you so much, Mrs. J. Hello, coders. I hope you're doing well and ready for your first scenario. Here we go. Of the following answers, which best describes the encounter? A. J96.00, I21.3, B. I21.9, J96.01, C. I21.3, J96.01, or D, J96.01, I21.9. A 65-year-old male presents with severe shortness of breath, altered mental status, and oxygen saturation of less than 90%. The provider documents acute respiratory failure and admits the patient. During the admission, the patient had an acute myocardial infarction. The patient's final diagnoses: AMI and acute respiratory failure with hypoxia. Of the following answers, which best describes the encounter? Coders, you'll have 2 minutes to solve. Your time will begin now. Good luck.
Thank you, Miss Dolly. Let's go ahead and let's highlight our key terms. We have shortness of breath, altered mental status, and low SATs. Then the provider diagnoses the patient with acute respiratory failure and then admits that patient. And during admission, the patient has an acute myocardial infarction or a heart attack, and these are our key terms. So right away, I can eliminate some things because I need to focus on what I need to focus. So shortness of breath is related to acute respiratory failure with hypoxia and an AMI. So let's go ahead and get rid of it. Altered mental status is definitely related to acute respiratory failure with hypoxia. I know firsthand, trust me. Also, low oxygen sats or low oxygen saturation rates. That's related to acute respiratory failure with hypoxia and also AMI, it could be. So on site, I'm going to say because the patient was admitted due to respiratory failure, I'm going to say that is the reason for the encounter. Now, just because I say it, I got to go prove it. But this is all we have. Our documentation doesn't say anything other than this patient had an acute myocardial infarction. We don't know if it was worked up. We don't know anything, but we do know that the acute respiratory failure was worked up. At least they did a an SpO2. S is for saturation. Saturation is how much oxygen is tied to the hemoglobin of the blood, sort of. It's a little more complex than that, but I tried to shorten it for you. Peripheral is where they measured or took the this how they measured it, okay? And O2 is for oxygen. So they use what we call a pulse ox or pulse oximetry. There you go, right there. So this P represents peripheral, and it was measured peripherally, where on the body. Yeah, so there you go. So this rate actually tells me that it was worked up and it was addressed. I don't know what they did for the AMI, but I do know that there is no answer that says query the physician, so I have to do my best. And therefore, acute respiratory failure with hypoxia is my answer. And I'm going to use the following guideline. And the guideline I'm going to use, ICD-10-CM. This is the guideline for acute respiratory failure as principal diagnosis. And essentially, it says that you can code from J96.0 and J96.2 when it is the condition established after study to be chiefly responsible for the hospital admission. Okay, coders, why was the patient admitted? Well, the patient was admitted for acute respiratory failure, and that is our first listed code. And it tells you to sequence from J96.0 subcategory first for acute and subacute conditions. And we do have acute respiratory failure. All right, so let's go ahead and let's look up our codes. Here's our J96.0 subcategory, acute respiratory failure, and we have I21.9, that's acute myocardial infarction unspecified, and I21.3, this is ST elevation myocardial infarction of unspecified site. We're going to talk about the differences between those two momentarily. But let's turn our attention to J96.0. I like J96.0. Acute respiratory failure, unspecified whether hypoxia or hypercapnia. Wait a minute. It was specified as hypoxia, so I take that back. Look at J96.01. This is acute respiratory failure with hypoxia. And if that is the case, that is the code J96.01. So if we turn our attention to our answers, A is sequencing J96.00 unspecified first. So let's go ahead and get rid of it. And while we're getting rid of things, let's go ahead and get rid of B and C because they are both sequencing the AMI first. And we know that acute respiratory failure with hypoxia must be sequenced first. So we're going to get rid of those two. And the answer will be D, acute respiratory failure with hypoxia, followed by acute myocardial infarction unspecified, and not ST elevation, STEMI, myocardial infarction of unspecified site. All right, so what is the difference between these two codes? Well, I21.9, this is an AMI that was not specified. The site wasn't specified and the type of infarction was not specified. So we don't know if this is a type 1 or 2. However, I21.3, we know this is a type 1 because if you recall last time, we learned that STEMIs, all STEMIs are type 1. And it actually says it down here. So if you read a little further. Okay. So this is a type 1. When you see I21.3, you know the type, but you do not know where the infarction occurred within the heart or the heart vessel. All right. So that is the difference between the two. Point 9, you don't know the type or the location. Point 3, you only know the type. You don't know the location. All right, coders. So sorry to be long-winded, but if you said D, outstanding. Way to go, way to go. And if you had an aha moment, I want to know. Talk to me in the chat. Go ahead. I want to hear you. Okay, Miss Dolly, please and thank you.
Thank you, Mrs. J. Of the following answers, which best describes the encounter? A. J15.3, J95.851, B96.5, B. J95.851, J15.3, B96.5, C. J15.3, B96.5, D. J95.851, B96.5. A 58-year-old male is admitted with shortness of breath, fever, and productive cough. Chest x-ray reveals pneumonia, and testing confirms group B streptococcus as the cause. He is started on IV antibiotics, but, due to worsening respiratory status, is intubated and placed on mechanical ventilation. On hospital day 3, the provider documents a new diagnosis of ventilator-associated pneumonia caused by Pseudomonas aeruginosa. Of the following answers, which best describes the encounter? Okay, coders, you have 60 seconds. Your time starts now. Good luck.
Okay, coders, how are you doing? How are those keywords or that inventory coming along? I want to know. Talk to me in the chat. I can't talk to you here, but I can talk to you in the chat. I have the puzzle piece. I'm one of the instructors with the puzzle piece. Just grab one of us and let us know. Okay, so what was your inventory? Here's mine: shortness of breath, fever, cough. X-ray revealed pneumonia due to strep group B or group B streptococcus. And then the patient got worse and had to be intubated and placed on a mechanical ventilator. And after being on that ventilator, the patient developed ventilator associated pneumonia caused by Pseudomonas aeruginosa. Okay, got it. Wow, I never said that before, but that's how you pronounce it. Okay, so let's get rid of these signs or symptoms integral to a diagnosis on this inventory list. Well, we see shortness of breath, fever, and cough, all related to both pneumonia as well as this VAP. So we're going to get rid of them. Now, do we know which one should be first listed? I truly don't know. I can guess and say, well, maybe it's number 4 because it says the patient was admitted with pneumonia. But I got a sneaky suspicion that there is a guideline that I need to reference first. So I'm going to just put a question mark right here. Now, let's go take a look at the guideline. Specifically, guideline ICD-10-CM. This guideline addresses ventilator associated pneumonia after admission specifically. And it tells you that you're going to sequence the pneumonia first, the pneumonia at admission, then you're going to sequence your VAP. All right, that's fair enough. So on site, we can get rid of B and D, right? Because it's sequencing the ventilator associated pneumonia first, right? Okay, so let's just go ahead and do our due diligence. Let's look up these codes. We have J15.3. This is pneumonia due to strep group B. I like it. And this is the pneumonia at admission. So this should be sequenced first as it is at A and C. Our next code is the VAP, J95.851, and it says ventilator associated pneumonia. And I like this instructional note here. It says use additional code to identify the organism. If known, it's a B95, 96, or 97 code. I like that. So let's continue to look up our codes. It's looking like the answer is starting to develop on its own, right? Because we know right now we need three codes, right? We need our first listed code, we need our VAP, and also it says, hey, if you have an organism, sequence that too. So if we have it, we need to sequence it and code it. And we do. B96.5, Pseudomonas aeruginosa. Yeah, it's right here. That is our third code. So let's go ahead and let's get rid of the distractions. B. B is incorrect because it's sequencing the ventilator associated pneumonia. So 2 is D. And that leaves us with A and C. And you can see that C is missing the VAP. I did not do that on purpose, coders. I really, really didn't. All right, so C is missing the VAP. It's got to go. And our answer is A. Yes, coders, A. Do you all see the importance of really knowing the guidelines, just having an idea that there is a guideline? You don't have to know those guidelines, just know they exist. And also, reading these instructional notes. It's gold. It will guide you. Okay, coders, if you got that correct, outstanding. All right, we got another scenario. Okay, Miss Dolly, please and thank you.
Thank you, Mrs. J. Which of the following best describes this encounter? A. J44.0, J18.9, B. J44.9, J18.9, C. J44.1, J18.9, or D. J44.0, J20.9. A 68-year-old male with a history of chronic obstructive pulmonary disease presents to the emergency department with shortness of breath, productive cough, and hypoxia. Chest x-ray confirms pneumonia. The provider documents chronic obstructive bronchitis complicated by pneumonia. Which of the following best describes this encounter? Okay, coders, you have 60 seconds. Your time begins now. Good luck.
Okay, coders, how are you coming along? Are you inventorying? I love inventorying because I know, I don't know, it just keeps me focused and I know that I am on the right track when I inventory. And I inventoried for this scenario and I put COPD, shortness of breath, cough, hypoxia, pneumonia, and chronic obstructive bronchitis complicated by pneumonia. Now, let's go ahead and get rid of some diseases that are, or signs and symptoms that are integral to some diseases on this list. First up, I'm getting rid of shortness of breath because it is related to hypoxia, pneumonia, and COPD and chronic obstructive bronchitis. I'm going to also get rid of cough. And I'm also going to get rid of pneumonia because it's related to number 6. Chronic obstructive bronchitis complicated by pneumonia. Yeah, so it's integral. So let's go ahead and get rid of pneumonia. We don't need to say it twice. And also, for that very same reason, I want to get rid of COPD because COPD is a non-specific term well, this one, just COPD by itself, it's non-specific chronic pulmonary disease, but it includes chronic obstructive bronchitis. So I'm going to get rid of it. And how do you know, Mrs. J? Well, I know because I read it in the MCG and I'm going to show you. But that leaves me with hypoxia and also chronic obstructive bronchitis complicated by pneumonia. And of the two, I think my chronic obstructive bronchitis complicated by pneumonia is my first listed diagnosis. Now, I'm going to show you how I know that chronic obstructive bronchitis complicated by pneumonia is related to COPD. Guideline IC-10A1. This guideline is for chronic obstructive pulmonary disease and asthma, acute exacerbation of chronic obstructive pulmonary chronic obstructive bronchitis and asthma. All right, so this guideline tells you that you need to sequence J44 when you're coding for COPD and J45 when you're coding for asthma. So as you can see, our answers are all coding for J44 category. I'm coding from the J44 category COPD. Now, this is how I know that what COPD includes because of this right here. It says COPD includes asthma with COPD, chronic asthmatic obstructive bronchitis, chronic bronchitis with airway obstruction, chronic emphysematous. That is hard, like emphysematus. There you go, bronchitis, chronic obstructive asthma, chronic obstructive bronchitis. Coders, chronic obstructive bronchitis, and it is complicated by pneumonia. This is included, it's included under COPD. And finally, chronic obstructive tracheobronchitis. So this is how I know that I don't have to code COPD in addition to chronic obstructive bronchitis. Now let's go ahead and look up our codes. J44.0.1.9 and J18.9 for your pneumonia and J20.9 for acute bronchitis. All right, coders, we're going to begin with J44.0. This is a good code. This is chronic obstructive pulmonary disease with acute lower respiratory infection, and it also tells you to code also to identify the infection. I like this code. We do have a lower respiratory infection. The pneumonia is a lower respiratory infection. Come on. And this is COPD with pneumonia. I like this J44.0. I do not like J44.1 because this is COPD with acute exacerbation. I don't like it because we don't have a circumstance where the doctor documents exacerbation. Exacerbation means worsening or decompensation. How do you know, Mrs. J? Well, if you look here in the middle of your guideline, it defines an acute exacerbation. It says it means worsening or decompensation of a chronic condition. The doctor only documented hypoxia, and hypoxia does not mean worsening or decompensation. It means that that there's not enough oxygen in the blood. That is what hypoxia or hypoxemia means. So I'm going to get rid of this J44.1. It's got to go. Got to go. Yeah. All right, so let's look at J44.9. I don't like J44.9 because this I know is the code for COPD, the general non-specific code for COPD. Our COPD was specified as chronic obstructive bronchitis, and I don't like J44.9. And it was specified specifically as having a lower respiratory infection, specifically pneumonia. So we're going to get rid of J44.9, got to go. And we're left with A and D. Now, what is the difference between them? Well, A is coding for J18.9 and D is J20.9. What is J18.9? Well, this is pneumonia. J20, this is acute bronchitis. And if you didn't know, pneumonia is the infection. Bronchitis is not. That's not an infection. So J44.0 tells you to code also the infection. I'm gonna let that marinate. Okay, coders. So if you said the answer was A, way to go. And if you had an aha moment, let me know in the chat because that too is outstanding. Pat yourselves on the back. Okay, coders, we have to move on. We're going to turn our attention to integumentary. In this section, ICD-10-CM Section C, Chapter 12, Integumentary, we're going to talk pretty much about skin conditions. But if I had to say there was one diagnosis that had more coding nuances, it would definitely be ulcers. Yes. What type of ulcer? Is it a pressure ulcer? Is it a non-pressure ulcer? What's a pressure ulcer? These are ulcers that formed typically on bony parts of the body. So where your joints are, typically. What's a non-pressure ulcer? Well, these are chronic non-pressure, right? So these are open wounds that can result from almost anything, from an infection, diabetes, right? Trauma, insufficiency, meaning lack of circulation, right? And when you're coding for these pressure ulcers, you're going to need to know some things like where is that ulcer? What's the type? Is it pressure or non-pressure? The laterality. which side of the body? How severe is that ulcer, right? So what is the stage? Um, and you're gonna, and just so you know, the stages are involve anatomy, right? So how much tissue was broken down? Is it all the way down to the muscle and bone? Okay, coders, make sure you have that forensic hat on, and I think you can do this. All right. And don't forget to flip to your Chapter 12 guidelines. And coders, you got this. So let's do it. Before we go anywhere, let's go ahead and review how to solve an ICD-10-CM scenario the AMCI way. Number one, inventory. Two, select that first listed code. Three, apply guidelines. Trust those guidelines. And okay, I'm going to hand you over to Mr. Sandeep. Okay, Mr. Sandeep, take it away.
Thank you very much, Miss J. And coders, are you ready for the first scenario? I know you all are. So here's the first question. Of the following answers, which best describes the encounter? Your options are option A L89.621, L89.623, option B L89.623, L89.621, option C L89.623, option D L89.621. A 72-year-old female is admitted with pressure ulcer of the left heel, documented as skin breakdown limited to the epidermis, stage 1 equivalent. During the hospital stay, the ulcer worsens and by discharge is documented as involving full thickness skin loss with damage to subcutaneous tissue, stage 3 equivalent. Of the following answers, which best describes the encounter? And you all have 2 minutes to solve this scenario, and your time begins now. So that is 2 minutes, and I can see a lot of great answers in the chat. Good job, coders. So let's go ahead and review the scenario. So let's look into the inventories which we have here, the signs, symptoms, and the diagnosis. So we have pressure ulcer of the heel, stage 1. It worsens later on, and there's a full thickness skin loss and a damage to the subcutaneous tissue, and pressure ulcer of the heel, stage 3. So that's all what we have here in the inventory. So which guideline do you think we are going to refer here? Let me know in the chat, chorus. Yes, we are going to refer the guideline C12A6 here, and the guideline is about the evolving pressure ulcers. And it states that when a patient with a pressure ulcer evolving into another stage during the admission, and when this scenario happens, you will have to code for the stage that was present on admission first, followed by the highest stage during the admission. And that should be your sequencing order as well. So over here we have L89.621 ICD code, which codes for pressure ulcer of the left heel stage 1. And from my inventory, I can see that it was pressure ulcer of the heel stage 1, which was present on the admission. Yes. And L89.623 ICD code is for the pressure ulcer of the left heel stage 3. And that is your stage 3 pressure ulcer code, which was documented during the discharge. So when patient got admitted, he had a stage 1 pressure ulcer of the heel, which later got worsened and it evolved to a stage 3 pressure ulcer. So as per the guideline, which one should be coded first? Yes, we have to code the stage 1 first, followed by the stage 3 pressure ulcer. Absolutely correct. So looking into our code options, I can see option C is coding and option D is coding for uh, stage 1 and stage 3 pressure ulcers only. So that is incorrect, right? As per our MCG referred guideline, we know that we have to code both the stages, the first stage followed by the second stage. So option C and option D are incorrect. Now it's about it between option A and option B, and option B is coding for L89.623 followed by L89.621. So it's coding for a stage 3 pressure ulcer first, followed by stage 1 pressure ulcer. And option B is also incorrect because it's following a wrong sequencing order. And the correct answer is going to be option A, L89.621, L89.623. Yes, option A is the correct answer. Great job, coders. You all did a fantastic job. So let's move on to the next scenario. So question number 2. Of the following answers, which best describes the encounter? Option A, L97412. Option B, L89613. Option C, L97419. Option D, L97411. A 68-year-old male presents with an open sore on right heel that has exposed fat but no bone involvement. The wound is chronic and not due to pressure. The provider documents a non-pressure ulcer with fat layer exposed. Of the following answers, which best describes the encounter? And code your clock starts ticking now. So that is time, and let's review the scenario. So here we have in our inventory a chronic non-pressure ulcer of the right heel, no bone involvement, and fat layer exposed. So here we are looking into the guideline C12B2, and that's for a non-pressure chronic ulcer stage. And the guideline states that assign appropriate non-pressure ulcer code based on the provider documentation of the ulcer severity. If the documentation does not specify the severity of a healing non-pressure ulcer, use a code for the unspecified severity. And in our scenario, the doctor did mention the severity. He said that there's no bone involvement, but there is a fat layer exposure. Yes. So this ICD code L89613, that's your option B, is coding for a pressure ulcer of the right heel stage 3. Well, option B straight away it's an incorrect because we are looking at a non-pressure chronic ulcer of the right heel and not at a pressure ulcer. So option B has to go straight away. It's incorrect. Now let's look into the next ICD, that is L97.411, which is for a non-pressure chronic ulcer of the right heel and midfoot limited to the breakdown of the skin. So once again looking into our inventory, we can determine that the ulcer severity is not limited to the skin breakdown. We had a fat layer exposed. That means yes, that means option D is also incorrect, which leaves us with option A and option C. Option C is coding for L97.419, which is for non-pressure chronic ulcer of the right heel and midfoot with unspecified severity. So once again, option C is also incorrect because that's for an unspecified severity of a right heel non-pressure chronic ulcer. And in our case, as we discussed before, the severity is mentioned. We had a fat layer exposure. So we have to code for the highest specificity. That leaves us with option A, and your correct answer is going to be option A, which would be non-pressure chronic ulcer of the right heel and midfoot with fat layer exposed. Yes. So option A is going to be the correct answer. Yes. Good job, coders. Let's look into the next scenario. Okay, coders, now let's look into the scenario number 3, and here's your question. Of the following, which best describes the encounter? Options are option A L89.153, option B L89.150, option C L89.159, option D L89.154. A 75-year-old female is admitted from long-term care facility with a pressure ulcer on the sacrum. The ulcer is completely covered with thick black scar, and the provider documents it as unstageable pressure ulcer. No debridement is performed during the hospital stay. Of the following, which best describes the encounter? And your 2 minutes starts now. And once again, you all did a fantastic job on this scenario as well. Great answers in. So here we have in our inventories pressure ulcer on sacrum, unstageable, covered with black eschar, thick black eschar. So for this scenario, we are going to refer the guideline C12A2. And the guideline states that the assignment of the code for unstageable pressure ulcer should be based on the clinical documentation. And these codes are used for the pressure ulcers whose stage cannot be clinically determined. For example, in the cases where the ulcer is covered by an eschar or has been treated with a skin graft or a muscle graft. So we did had a similar kind of a scenario with us now, where the ulcer has been completely covered with a thick black eschar and the doctor was not able to document the stage or was not clinically able to determine the stage of the ulcer. So he documented it as an unstageable pressure ulcer. So remember coders, this code should not be confused with the codes for the unspecified stage. So where there is no documentation regarding the stage of the pressure ulcer, assign the appropriate code for unspecified stage. So the code for unstageable ulcer would be L89.-O, and the code for unspecified pressure ulcer would be L89.-9. Okay, so here in our scenario we have option A coding for L89.153, that's for a pressure ulcer of the sacral region stage 3, and L89.154, which is our option D, is coding for a pressure ulcer of the sacral region stage 4. So as I said previously, in our scenario, the doctor or the provider was not able to determine the stage of the pressure ulcer. So it's not going to be stage 3 or stage 4. So option A and option D both are wrong. And option C is coding for L89.159. That's for a pressure ulcer of the sacral region, unspecified stage. So referring to the guideline, in our scenario, we have a ulcer whose state cannot be clinically determined. So that's not an unspecified stage. So L89.159 is also incorrect, and the correct answer is going to be option B, L89.150, and that would be for pressure ulcer of the sacral region, unstageable, and option B is your correct answer for this scenario number 3. So great job coders. I saw a lot of you got this one correct, so good work. And now let's move on to the next scenario. So question number 4. Of the following, which best describes the encounter? Options are option A, L97413, E11.621, option B, L97.419, E11.622, option C, L97.419, on option D, 11.621. A 66-year-old patient with type 2 diabetes mellitus presents with the non-pressure ulcer on right heel. The provider document the ulcer has necrosis extending into the muscles layer. There is no mention of peripheral circulatory complication or gangrene. The patient is receiving wound care treatment at the outpatient wound clinic. Of the following answers, which best describes the encounter? And your 2 minutes starts right now. So see you after 2 minutes, coders. All the best. And that is 2 minutes, and you all are doing a great job. You all are on fire today. Excellent job. So here we can use multiple ICD guidelines. The guideline C4A is for the diabetes combination codes and states that the diabetes codes are combination codes that include the type of diabetes, the body system affected, and the complication affecting the body system. As many codes within a particular category as are necessary to describe all of the complication of the disease may be used, and they should be sequenced based on the reason for particular encounter. So the diabetes combination code includes the type of diabetes, the body system affected, and any complication as well. So here we had a patient with type 2 diabetes mellitus presenting with a non-pressure ulcer of the right heel. So yes, over here we can use the combination code, and if you go to the alphabetic index and search under the diabetes with foot ulcer, it will direct us to 11.621, and once we cross check 11.621, we will find that it's coding for type 2 diabetes mellitus with foot ulcer. And you can also find an instructional note below it asking us to use additional codes to identify the site of the ulcer. Yes, so along with 11.621, we will also have to use an ICD code to identify the site of ulcer. But option D is not coding for a site of ulcer. Yes. Also option C is also coding for L97.419, which is for non-pressure chronic ulcer of the right heel and midfoot with unspecified severity. So it's only coding for an ulcer code. It's not using a combination code of diabetes with ulcer as well. So I can easily say that option C, option D, both are incorrect. And between option A and option B, option B is coding for 11.622, which is for type 2 diabetes mellitus with other skin ulcer. So we have a highly specific code in 11.621 that is for type 2 diabetes mellitus with foot ulcer. Also referring to the guideline C12P2, it also asks us to assign the appropriate non-pressure ulcer codes based on the provider's documentation of the ulcer severity. And in our scenario, the doctor documented the severity of ulcer as necrosis extending to the muscle layer, right? Yes. And the ICD code L97.419 is for a non-pressure chronic ulcer of the right heel and midfoot with unspecified severity. So that's coding for an unspecified severity. And L97.413 is coding for a non-pressure chronic ulcer of the right heel and midfoot with a necrosis of the muscle. So it's exactly what we have in our inventory. So we have a type 2 diabetes mellitus and a foot ulcer. Yes, a non-pressure foot ulcer and the necrosis extending to the muscle layer. So we have to sequence based on the reason for visit, and here the treatment and the visit is for a non-pressure ulcer of the right heel. So we sequence L97.413 as first and followed by 11.621. So your correct answer is going to be option A, and you all did a fabulous job, coders. So I think it's time for me to hand over to Miss J. Miss J, you can take it over. Thank you.
Thank you, Mr. Sandeep. And coders, are you ready for chapter 13? ICD-10-CM section C, we're going to talk about musculoskeletal system. And of course, this chapter focuses on conditions that affects the bones, joints, muscles, tendons, and connective tissue. So this also includes conditions like arthritis, fractures, joint disorders, and systemic connective tissue diseases. But if I were to say that there were a diagnosis or classification of diseases, I would say osteoarthritis and pathological fractures. That's what you need to really focus on. They have the most um, nuances, guideline nuances. Okay, coders, are you ready? Okay. Go ahead and grab your chapter 13 guidelines. And one more thing, we have to solve the scenarios the AMCI way. One, two, three. Inventory, select, and apply. Okay, coders, now let's go. Of the following answers, which best describes the encounter? A. M25.561, B. M23.61, Z87.820, C. S83.511A, D. M23.61, S83.511S. A 45-year-old male patient presents to the orthopedic clinic with right knee pain. The provider documents that the patient has chronic right knee pain due to an anterior cruciate ligament or ACL tear that occurred during a football injury 5 years ago. The patient states that the current ACL tear is related to that prior injury. There is no mention of a new injury or recent trauma. Okay, coders, your time begins now. Okay, coders, how did you do? How do you think you did? Okay, let's go ahead and let's do our due diligence. We have right knee pain. Look at that. It's gone. Also, we have chronic right knee pain. And third, we have a right ACL tear. And fourth, previous football injury. All right, so we know we can get rid of right knee pain. We also know we can get rid of a chronic right knee pain as well because they're both related to that right ACL tear. Now, what is our first listed code? Why did that patient walk into that orthopedic clinic? Well, they walked in because they had right knee pain, and the doctor said, hey, you have a right ACL tear. There you go. That's your first listed code until a guideline says otherwise, right? Yeah. So we do have a guideline, but we don't have any guidelines in the musculoskeletal system that's driving this selection. No. Guideline IB10. This is a general coding guideline that I'm going to follow. I don't see any guidelines in the musculoskeletal section, but I do see this guideline, and this is the guideline for sequelas. Yes, this patient had a football injury to that ACL, right? Yeah. And when you do, it says you have to sequence the condition or the nature of the sequela, and that is the reason he came in today, followed by your sequela code, right? Sequela code is second. Now, let's go ahead and let's look up these codes. If we look under the M25.56 category, this is the code for knee pain. I don't like that already, right? Because we've already got our diagnosis of right ACL tear. And if we look under M23.61, other spontaneous disruption of anterior cruciate ligament of knee. I like that one. I do. So we're going to get rid of C. You have to go because you're coding for right knee pain. And also you're coding it as, excuse me, no, you're not coding for right knee pain. We're coding for the sequela. We're coding for that acute injury, right? Yeah. How did you know? Because it begins with a S. Those are acute injuries. That means it happens right now. So S83.511, this is sprain of anterior cruciate ligament of right knee. That is a tear. Yes. Guess who knows firsthand? Me. I have one right now. It's not anterior though, it's lateral. Yeah, I think I'm an athlete. All right, the appropriate seventh character is to be added to each code from SA3. A is for initial encounter. That means it's acute, it's happening right now, or they're still treating it, right? D is subsequent encounter, and C is sequela. So I like the sequela. We're not going to code this tear as now. We're going to code this tear, aka sprain, as sequela because it happened before, and our guidance says you have to sequence that sequela second. On site, we see the answer, right? Just saying. Okay, so let's just go ahead and do our due diligence. And if you look at M25.561, this is not the answer because it's coding for knee pain. We've already ruled out knee pain. We're more advanced than that, so we're going to go. Now, the difference between B and D is B is coding for Z87.820, and this is the code for personal injury of other healed physical injury and trauma. Wait a minute, coders. Anytime you have a personal history code, it means it's completely healed or eradicated from the body, and the patient no longer is requiring treatment. Well, it looks like we've got a sequela. So we do still require treatment. So we are going to eliminate B, and D will be our answer. Indeed, it's sequencing M23.611, other spontaneous disruption of anterior cruciate ligament of right knee, as well as the sprain of anterior cruciate ligament of knee, sequela. And coders, if you said D, outstanding. Coders, how are you doing? Good? Talk to me in the chat. I want to know. I'm here for you. Please. Okay, coders, if you got that correct, outstanding. We got another scenario. Of the following answers, which best describes the encounter? A. M80.08XA. B. M81.0. C. M80.88XA. And D. M81.8. An 83-year-old female presents to the clinic for evaluation of long-standing osteoporosis. She has no history of fractures. The provider confirms osteoporosis without any current pathological fractures. Okay, coders, your time begins now. Okay, how did you do? Okay, I know you're doing good. I know it. All right, so here is the inventory coders. You've got osteoporosis, no fracture, osteoporosis without pathological fractures. Well, I think we can just get rid of osteoporosis and no fractures because they're integral to number 3. And coders, we do have a guideline. This guideline is IC13D, and this is the guideline for coding osteoporosis. Essentially, it says use M81 osteosis, no fracture, systemic when the patient has osteoporosis with no fractures, no pathological fractures. M80 when a patient has osteoporosis when they do have fractures. And it says always use M80 codes if there is a pathological fracture. Okay, coders. So if you look at our inventory, this patient does not have a pathological fracture, so we have to code from the M81 category, and we can eliminate 2 on site, right? Yeah. So let's go ahead and do our due diligence. We're going to look up our codes. And to me, this scenario is going to bring forth aha moment. And it's also going to tell you about the way we do things here at AMCI. Yeah, some people don't like it so much, but it is the right thing to do. All right, so let's look at our codes, coder. If you look at M, let's start with A, M80.08XA. M80.08. And these two, your seventh character extender will be A and your X will be placed here. This is the code for age-related osteoporosis with current pathological fracture. Okay, so we don't have a pathological fracture. We know we can get rid of that, right? Yeah. Now the next code, let's look at M0, M80.88XA, other osteoporosis with current pathological fracture. We have no fracture. So we're going to get rid of C. And that leaves us with B and D. B is age-related osteoporosis without current pathological fracture. And D is other osteoporosis without current pathological fracture. Okay, coders, on site, I would just say, all right, it's got to be M81 other osteoporosis because the doctor really, no, it can't be other. It really can't. The doctor never specified the type of pathological fracture. They didn't. And on top of that, there's nothing, no option for us to query the physician because that is what I would have done. But our job is to check or select the answer that best describes this encounter. So I'm going to need to do a little more reading. So under age-related osteoporosis, now yeah, this patient is 83 years old, but I'm not in a position to say that this is age-related osteoporosis, right? We can assume and deduce, right? But let's look underneath. It says to use this code, typically this person has involutional osteoporosis without current pathological fracture or osteoporosis not otherwise specified. I like that. Osteoporosis. It's not otherwise specified. Also, postmenopausal osteoporosis without current pathological fracture. We can assume this patient is postmenopausal, but we don't know, do we? Senile osteoporosis without current pathological fracture. So it does relate to the person's age, and I really love this osteoporosis not otherwise specified. Also, if we look at M81.8 and you look underneath, this other osteoporosis involves drug-induced osteoporosis, idiopathic osteoporosis, osteoporosis of disuse, post-oophorectomy osteoporosis, post-surgical malabsorption osteoporosis, post-traumatic osteoporosis. Okay, coders, this aha moment or this teachable moment is when the doctor is not specific, then you have to look at your documentation. It is not our job to assume anything at this juncture. When you get in the real world, absolutely, you will be given the authority. But right now, we don't do it. And you might even see some answers on the exam where there is a where they're telling you to make some kind of assumption. You can do it. We will give you the tools to make assumptions, but at this juncture, you should not because it's wrong. We cannot practice medicine. No, the doctor has to give us permission. All right, so it is age related, not because it says age related and the patient's 83, but because underneath here, the supplemental language, osteoporosis, not otherwise specified, that is indeed why. That gives us B. It is the best of the four. And if you said B, coders, outstanding. And I hope you had an aha moment. I do. I do. All right. We've got one more. Let's do it. Of the following answers, which best describes the encounter? A. M87.050, B. M87.051, C. M87052, D. M87059. A 70-year-old patient with hip pain. Imaging reveals avascular necrosis involving the upper end of the right femur near the hip joint. The provider documents avascular necrosis of the right femoral head of the hip joint. Okay, that was saying a lot. Okay, coders, you've got 2 minutes. Your time begins now. Okay, coders, how are you doing? I want you all to talk to me. Right now, I'm talking to myself, but I'm in the chat right now. Come on, let me know how you're coming along. All right, so inventory. From the documentation, I have hip pain, hip joint, avascular necrosis of the right femoral head at the hip. I see a lot of hips, right? So let's go ahead and get rid of hip pain, hip joint. And our first list of code is avascular necrosis, right femoral head at the hip. So I just want you to know that it's important to know where your major joints are. It just is. And maybe it's not pertinent here, but I just wanted you to know. So you've got your neck and the vertebrae going all the way down. These are all major joints. You've got your elbow joint, wrist joints. Right here, your This is your sacroiliac joint, right? And then here's your hip joint. This is where our procedure is, or our diagnosis is. And this is your knee joint and your ankle and toes. So these are your joints. It's important that you know it's not pertinent to this scenario per se, but you got to know the difference between your bones and your joints. And just saying. Okay, so we have avascular necrosis of the right femoral head at the hip. So it's right here, coders. It's right here. Okay, a little bit down from that point, right in that little socket right there. That's what we're coding for. So, do we have a guideline? Not necessarily, but this guideline kind of reminds me of some things, and I'm going to share it with you. IC-13A1. This guideline is used to code for bone versus joints, and it also speaks about the site of the diagnosis and laterality. And pretty much when you have bone and joint circumstances, you're going to code for the bone, not the joint, right? So if the bone is affected and the joint, you're only going to code for the bone. Now let's get back to our subject, right? Our subject is that we have this avascular necrosis, right femoral head at the hip. And I showed you where it was, right? Yeah, so here's a bigger picture. Right femoral head at the hip. This is the piece that goes right in there. Boom, right? So this is what we're coding for. And where is this? This bone is the femur. This is going into what? The pelvis, right? Just saying. This is one of those circumstances where it helps to know anatomy. It does. So let's look at our codes. You have M87.05, idiopathic aseptic necrosis of pelvis and femur. Remember in ICD-10-CM, and means and or, right? So pelvis or femur. All right, so M87.050 is for the pelvis. 51, 52, and 59 are all for the femur. Okay, coders, can we eliminate anything? All right. So if you said you can eliminate the femurs, outstanding, because that femur, that thigh bone, was not the point of focus, more up in the pelvic area, the pelvic bone. I'm going to let that marinate. Okay, coders. So we're going to get rid of all these femur codes. M87.051, 52, 59, and if you said M87.050, outstanding. Okay, coders, it's time for us to switch gears. In this section, we're going to discuss urinary ICD-10-CM section, C chapter 14. In this section, we focus on the kidneys, ureters, bladder, and urethra. That's pretty much your urinary system and the conditions associated with those parts. We're going to say body parts. And are there any coding nuances? Well, welcome to CKD. This is where that N18 code lives, and we've been pretty much coding it up to this point, especially in hypertension, in the hypertensive or circulatory system. So if I were to say any coding nuance that you need to pay attention to, I think you already know it, and it is CKD indeed, chronic kidney disease. All right, coders, you can do this. All right, go ahead and flip to Chapter 14 in your guidelines, and don't forget to inventory. Select your first listed, apply the guidelines, and trust those guidelines. Okay, Miss Bianca, please and thank you.
Thank you, Miss J. Okay, coders, let's dive into this first question. Of the following answers, which best describes the encounter? A, N18.4, Z99.2, B, N18.6, Z99.2, C, N18.6, N18.5, Z99.2, D, N18.3, Z99.2. A 67-year-old male with history of chronic kidney disease presents for routine follow-up. The provider documents CKD stage 5 and stage renal failure with declining kidney function and on dialysis. You all have 2 minutes. Your time begins now. All right, so let's get on to our inventory. So for the inventory, I put history of chronic kidney disease, CKD stage 5, end stage renal failure with declining kidney function, and dialysis. And I'm not going to eliminate anything from this inventory list, so let's move on to our guideline. So for the guideline that I used, first of all, we have our inventory list in the left corner there, but the guideline that I used to help me solve this scenario was Chapter 14A. And this guideline tells us that when we have CKD staging, N18.2 through N18.4 for CKD stage, if the patient has end-stage renal disease and dialysis is indicated, assign Z99.2 for the dialysis, and we'll code first the end-stage renal disease only. So let's move on here. And as you can see over here in the left corner here, we have that ESRD, which is the N18.6 code. So let's take a look at these codes. Let's look at this Z99.2, which we already know is going to be our code, but just so we know what it is the dependence on renal dialysis, so we like it, and the guideline tells us to use it, so we are going to keep it because we do have dialysis listed up here. Now, N18, chronic kidney disease, we have our notes, which you always want to make sure you're checking here. And then we are going to take a look at this N18.3, which is chronic kidney disease, stage 3, moderate, not applicable to our case because we have stage 5 listed. So we are going to get rid of that, which gets rid of D. And let's move down to N18.4, which is chronic kidney disease, stage 4, severe. Once again, we have stage 5, so this isn't going to be our code. We're going to get rid of that one as well, and also get rid of A. And moving down here to this N18.5, which is chronic kidney disease stage 5, which we do have, but we got to take a look at these notes that they have listed here. We have a tip listed. When both ESRD and CKD5 are documented, code only for the ESRD. This is also what our guideline had told us as well. So that means we are not going to code this chronic kidney disease stage 5. We are just going to code for that end stage renal failure. So we're going to get rid of N18.5, which gets rid of C, which only leaves us with B, but let's still take a look here at this N18.6, which is end-stage renal disease. And as you see here, we have another note telling us again to use an additional code to identify dialysis, the Z99.2, which we already have over here. And then it gives us another tip again about only coding the end-stage renal disease and not coding the CKD stage 5 if both are documented. So this is definitely going to be our code, which leaves us with our answer B in 18.6, Z99.2. All right, coders, I hope you guys all got that correct. And let's move on to the next one. All right, so question number 2. Of the following answers, which best describes the encounter? A, N18.30, Z94.0, B, N18.6, Z94.0, C, T86.10, N18.32, Z94.0, D, N18.30. A 58-year-old female with a history of kidney transplant presents for evaluation of her chronic kidney disease. The provider documents stage 3 CKD. There is no mention of any transplant complications such as rejection or failure. You all have 2 minutes. Okay, coders, let's get our inventory list started here. So I have history of kidney transplant, chronic kidney disease, stage 3, and I also have no mention of any complications. And so what I'm going to eliminate here is just this chronic kidney disease since we have the stage 3 CKD already listed. And let's move on to our guideline. So I use chapter 14A2. And this guideline tells us that when we have chronic kidney disease and kidney transplant status, we code first that chronic kidney disease, that CKD code. Second would be the transplant status. And then this third code here would be dialysis if it's applicable. And we do have like a little portion of the guideline here that tells us that just because they've undergone the kidney transplant and they still have CKD doesn't necessarily mean that it's a complication. So they can have a transplant and CKD. That doesn't necessarily mean there's a complication. Okay, so I do have the sequencing order here from our MCG just in this corner here as a reminder. Let's take a look at this T8610 complication code. We know we're not going to use it, but just so that we're aware of what it is. So this T8610 is complication of kidney transplant unspecified. So we know that we're not going to use this because we have no mention of a complication, and just the presence of CKD alone we know isn't enough for a complication. So we are going to get rid of C. And now let's take a look at our CKD codes, the N18 category. And as always, make sure we review our notes. But let's pop down to this N18.6, which is end-stage renal disease. We have no mention of end-stage renal disease. We just have a stage 3 documented, so we know that this is not going to be our code. So we are going to eliminate this, which eliminates B. And now let's look up at this N18.32 as well, even though we've already eliminated C. Just so you all know, this N18.32 is the stage 3B, which we don't have a letter associated with our stage 3, so it's not going to be applicable as well. And now let's look up at this N18.30, which is chronic kidney disease stage 3 unspecified, which is more in line with what we have here. Like I said, we only have that stage 3 listed. We don't have the A or B with it. So this is definitely going to be the CKD code that we are going to use. Now let's move on to this Z94 transplanted organ and tissue status. Z94.0 is kidney transplant status. So this is just us indicating that this patient has a kidney transplant on theirs as well. And so our guideline here does tell us that we want to make sure we list that. So we're going to eliminate D because it's not listing it. And so that leaves us with A, N18.30, Z94.0. All right, coders, I hope you guys all got that correct. And we'll move on to the last one. Okay, coders, question number 3. Of the following answers, which best describes the encounter? A, I12.9, I50.9, E11.22, N18.4, B, I11.0, I50.9, E11.22, N18.4, C, I13.0, I50.9, E11.22, N18.4, or D, I13.10, I50.9, E11.22, and 18.4. A 66-year-old male with a history of hypertension and diabetes mellitus presents for their evaluation. The provider documents hypertensive heart and chronic kidney disease with heart failure, stage 4, CKD, and type 2 diabetes mellitus with CKD. You all have 2 minutes. Okay, coders, let's start with our inventory list. And I put hypertension, diabetes mellitus, and then hypertensive heart and chronic kidney disease with heart failure, stage 4 CKD, and type 2 diabetes mellitus with CKD. And so I'm going to eliminate 1 and 2 here just because we have it listed in this number 3 and number 4. And for the guideline that I use, I actually used 2 guidelines. So I used chapter 14 guideline and a chapter 9 guideline. So let's first take a look at the chapter 14 guideline. Here, chapter 14, A3. And this tells us when we have chronic kidney disease with other conditions, we use the notes that are in the tabular list to help guide us to sequencing order. And this particular portion of the guideline just kind of helps solidify this. Patients with CKD may suffer from various types of other conditions, like diabetes mellitus. So that helps us a little bit. But if you see over here, we have C chapter 9, which we're going to look at as well. So let's go to this chapter 9 guideline. So chapter 9, A3, which is hypertensive heart and chronic kidney disease. And so this one tells us when we have hypertension, heart failure, and CKD in the same setting, we sequence first that I13 code because the 3 organs, and then second, your CKD staging code, and third, your heart failure, obviously, if applicable. And so now let's move on. So based off of that guideline, we are going to eliminate options A and B because these are not sequencing for that 3 organs. It's the 2 and the 1. So I know that these aren't going to be our code. I know we are going to be in the realm of that I13 code here. So now let's take a look at all these other codes because really the only difference we have here is this I13 code. Everything else is the same, but we're going to take a look at each one of these here. So let's first start off with this I13, hypertensive heart and chronic kidney disease. And we have under this I13.0, we do have a note that tells us to use an additional code to identify the type of heart failure or use an additional code to identify the stage of chronic kidney disease, which is very helpful. So we do like this code because this is hypertensive heart and chronic kidney disease with heart failure, and it's stage 1 through stage 4 chronic kidney disease. So this is in alignment with our encounter here. So now let's look at this I1310 code, even though we know we like this one up here. We're going to eliminate this one because this is without heart failure. So we're going to eliminate D, which leaves us with C, but still let's take a look at the rest of these codes. So we have our I15 BOSS, and up at the BOSS we have some notes that tell us to, when you have heart failure due to hypertension with chronic kidney disease, it tells you want to use that I13 category right here. And so we have this I50.9 heart failure unspecified, which is what we're going to use to document our heart failure in this encounter. And let's move on to this E11 BOSS over here, the type 2 diabetes mellitus. We do have notes, includes and excludes. Nothing particularly applicable at this level here for our encounter. So let's move down and look at this E11.2 subcategory. So E11.22, type 2 diabetes mellitus with diabetic chronic kidney disease. And as you can see here, we have a note that says use additional code to identify the stage of chronic kidney disease, and it gives you the range here. So we like that E11.22. And for our chronic kidney disease code here, we have notes again telling us to code first any associated diabetic chronic kidney disease, which we do have our E11.22 in here. And then hypertensive chronic kidney disease, we have this listed in here as well. And it's telling us also, if applicable, if we had a kidney transplant, we would code that as well. So this N18.4, chronic kidney disease stage 4, which is in aligned with our encounter, is correct. So we are left with our C, which is I13.0, I50.9, E11.22, and 18.4. So I hope you guys all got that correct. And as you can see, our tabular notes here helped guide us, even if that guideline didn't give us like a specific sequencing order. But this kind of here helps tell you how you should have these listed here. And that's it, coders. Thank you so much. And I'm going to hand you back off to the wonderful Miss J. And I will talk to y'all next week.
Thank you, Miss Bianca. And this sums up our instruction of chapters 10 through 14, ICD-10-CM. I want to remind you to continue to self-study these chapters. And if you have the MCG, it's a good study tool. Now, let's go ahead and review the homework. All right, so if you don't have the syllabus, you can go to the website www.amcicoding, click on YouTube course. After clicking on the course, scroll down until you find the 16-week YouTube course syllabus. Click on it. No, the website is just a replica of the syllabus, so click on it. And when you click on it, you'll see the books. You'll come to the textbooks first. Then I need you to scroll down until you get to week 6. That's this week. First thing you're going to do, you're going to download the PowerPoint. If you're in Discord, you go ahead and you can download the PowerPoint, and I'll show you in a minute where you can find it. Number 2, you can watch the playback from this class. Yes, it will be on that green hyperlink. Go ahead and watch the playback if you need to. Number 3, if you want to, you can read the official coding guidelines right here. Just click on the blue link. Number 4, if you have the MCG, if you want to read the guidelines there, you can. Next, bucks. All right, so there are 2 units that you're going to need to cover for this reading in bucks. So in unit 2, chapter 5, I apologize, there are 2 chapters. So unit 2, chapter 5, you can find respiratory system. And if you go to unit 2, chapter 6, you can find digestive, skin, musculoskeletal, and genitourinary system. And there's a chapter review. I encourage you to do that chapter review. And this is unit 2, chapter 6. And if you would like to, go ahead and circle back and do the chapter review for chapter 5. All right? Number 6, don't forget to watch the MCG TAP lecture. There's only one this time, and we only have one for the respiratory system. Okay, if you have the 2025, you can find the lectures on this link. It says charts, videos, exams, and additional resources. I think it's like the second page, so it's really close up. Also, if you want more practice questions, you can find them in Discord, right? So yeah, we have about 15 practice questions on these subjects, and do not hand them in, coders. All right, they're for you. But if you have questions about them, go ahead and ask in Discord. Also, this is where you find it in Discord. You just enter Discord, and on the left, under resources, you can either download them or click the link. It's up to you. All right, coders, we are here. We have finished week 6. You did it. You did. We wrapped up respiratory, Integ, musculoskeletal, and genitourinary. So go ahead. You can start working on your own, become familiar with those guidelines. Now, next week, we're going to shift gears and we're going to focus on chapters 15, 16, and 17. This is obstetrics, perinatal, and congenital disorders. Now, if you want to, you can get ahead, jump on things and look at those guidelines. Feel free. But I just want to tell you, you are amazing. You did it. And if you like this, if you like this class, help us make it even better. We've got a survey team. The survey is in the notes. Yeah, last two times they couldn't find it, but the survey link is there, and that is the correct link. I checked it myself. So please add it to the chat so they can get it. And thank you in advance for all of you who filled out the survey in the past and who's going to do it tonight. You all help us more than you know. And these adjustments that you see, they're coming from you, coders. And if you found this lecture helpful, don't forget to hit that like button. See right here? That like button? It helps more future coders discover AMCI and it keeps this instruction free, right? And going strong. And believe me, coders, one click up or down, if you don't like it, click it down. It does help us. It helps us go a long way. And I just want to thank you in advance. And speaking of thank you, amazing team. I want to celebrate you, you all. I want to thank you for holding the line of excellence, coders. And that's all. Because of you, AMCI doesn't just teach coding. We transform. I'm going to let that marinate. And you are indeed the best and the baddest. And coders, thank you for being amazing too. And I just want to remind you that this journey won't always be easy, but you are capable, you are strong, and you are meant to do this. All right, coders. So go study, go practice, and go be great. We will see you in the next session.
4,000 exam passers and free classes at AMCI. Learn to code straight from home or on the road at AMCI. We're on the East Coast, the West Coast. We're all around the world. AMCI.